Okay, well, my name is Kim, and I am 4 days after surgery, and I don't know the medical terminology, but I had the extra skin taken off of the top of my eyes, and I had some fat injections under my eyes, and then I had a lift to get rid of the extra skin under my chin, and I had a natural frowny face that I didn't like because I'm a happy person, and so I wanted to, when I'm not laughing and talking, to look happy and peaceful like I really naturally am. And so we did a little bit of lift right here. For my procedure, I chose to have the full, I don't know what it's called, but the full anesthesia where I was not awake at all for the procedure. I typically get very nervous about anything medical related, and I get a little bit of anxiety for any kind of procedure, and basically a big fraidy cat when it comes to any kind of pain. And that was really helpful to me as a patient to have the choice of being local anesthesia or the full anesthesia, and to have the 3 different procedures that I had done. It was very helpful to have the full anesthesia because I went in a good mood and went to sleep, and then I woke up and it was completely done, and I didn't have any anxiety at all. So when we discussed what my options were on how to carry out the surgery, one of the big fears that I had was feeling any kind of pain. And I felt like the conversation with Dr. Authray was really helpful because he basically explained that I'm really not going to feel pain in any case. I think it was more just the peace of mind factor that I wanted to consider for myself. Because I was having multiple procedures, it was going to take multiple hours, and I thought I might suffer kind of some anxiety over being kind of naturally an impatient person, and so I might get afraid that it's taking too long. And so when we talked about the pros and cons of the different anesthesia, one thing that was really interesting to me is that anesthesia, whether I was partially awake or asleep, the risks medically for the anesthesia were pretty similar. And so it really boiled down to what my choice of knowing myself and knowing what kind of my anxieties are. And I felt like I had a lot of information to make an informed decision for myself. Actually pleasantly surprised. So I think as any normal consumer, when we're looking for particularly this level of a procedure for ourselves, you know, the internet can be your enemy or the internet can be your friend kind of thing when you're doing research on medical, because you can get pretty scared or pretty excited just depending on what you're reading. But one of the things that I was very prepared for was a significant level of swelling and bruising. And just knowing me as being a natural anxiety person when it comes to medical things, I was expecting to kind of look like maybe I just got out of a car wreck or something after the procedure is what I was prepared for. Every person is different, every healing is different, every person's body is different, their level of health is different. And so I just wanted to, because I wanted to do this for me, I was very excited at the opportunity to rejuvenate my face, and so I felt really fortunate to be in a position to afford this kind of a surgery and take care of myself in this way. And so I knew myself that I didn't want to panic if there was more bruising than I expected. And I was looking in the mirror this morning at 4 days out, and there's really very minimal bruising, and I couldn't be happier.
Hey, Dr. Authray here. This is Kim. So Kim is 4 days post-op, status post total facial rejuvenation. There's a couple of things that I want to point out about her, which I think are very interesting, which I continue to learn, develop, evolve, okay? So she's had deep plane facelift, deep plane neck lift, the whole 9 yards that I normally talk about and all that jazz. Cool, awesome. Yeah, let's get over that. So one of the things that I normally do for almost all of my patients is use drains, okay? I even prepared her, if you remember, I told you are going to have drains. And this is something, because I do it with such degree of frequency, this is something that I do. But But as I went into the surgery and looked at her anatomy, did her surgery, and I achieved this like really crazy tight jawline here, I recognized a few things with her anatomy that I didn't think that I needed to do drains. So therefore I changed it, and you'll see some of her pictures on post-op day 1, post-op day 4, where she's got all these sutures all the way here. That is called a hemostatic net. And what that suture does is it goes in and out, in and out, in and out, and it takes this layer and squishes that layer down against the underlying layers so that there's no room for the blood to collect in. And that's part of the reason why she has very little bruising and swelling and all that kind of stuff. So what the take-home point in this is as follows. I look at myself kind of like Santa Claus, okay? I have this big bag of toys. I've got drains, and I've got hemostatic net, and I've got all these kinds of things. And one of the things to people who are watching this on YouTube and all these kinds of things, there really isn't one way that is the perfect way that it has to be done every single time. Every Kim, every patient is different, okay? Kim may have a twin sister, and if I did her twin sister's case, it's gonna be different than Kim's case. And so therefore, I gotta modify the procedure to fit the patient and use whatever like little toys that I have that are within my bag of tricks in order to achieve the result that I wanna achieve. So when patients kind of send me, and you can probably understand this, they send me emails going, hey, I want a deep plane facelift without drains or whatever. I don't know if I can achieve that because I haven't seen them, I haven't seen their anatomy. And so basically what we do when we do, and Kim can agree to this, I prepare you for the worst. I tell you everything that I may or may not have to do. And then I actually even told you, like, there's a little bit of this art process that when we get into the OR, I go, hey, you know, I may have to change the game plan a little bit.
Yeah, I think that is preferable to me because I don't really have any knowledge. I mean, we can read all we want to about different procedures, but I'm not the doctor, I'm not the one doing it. So I'm glad that you are mindful about what my body needs are and what's going to be the best fit for me.
Okay, and another thing that I'm very happy about Kim. So Kim and I had you've heard, everyone who knows me on Instagram and Facebook and YouTube and all those places, they know I'm the local anesthesia guy. I had the same talk with her, okay, and she said, no way in hell. Absolutely no way in hell.
Correct.
Okay, which actually, you know, I don't take offense to that. I'd rather know up front because the last thing I want to do is go into the OR under local anesthesia, start dinking around, you have a panic attack, and then it is a bad situation for you and me. So therefore, when she just tells me point blank, sorry, Poppy, ain't not gonna happen, okay, and I need to go to sleep, cool. I mean, it's easy. So a couple of things that I really want prospective patients out there, or even patients who are going to see another doctor, whatever. 100% honesty with your surgeon is absolutely important. I mean, this is a mutual relationship based on trust, okay? So the more she can tell me about her body, the way she thinks, the way she acts, the way she feels, all these kinds of things, the more things that I have that I can now reach into my bag of tricks, whether it's general anesthesia versus local anesthesia, whether it's deep sedation, this, whatever it might be, to make her happy, satisfied, which then makes me happy, satisfied, which allows both of us to achieve our goals.
I think it's really good that you actually listen to me because when I first started even just coming to you for Botox, I had to hold the teddy bear because I had so much anxiety about the needles coming into my forehead. So I think that your practice has been customized to fit what my needs are, and I appreciate that.
Yeah, because I mean, and a lot of this is not, it's from A, experience, and B, from my own experiences as being a patient. You know, I mean, most of the time when I go see a doctor, I don't tell them I'm a doctor. You know, many of my, you know, I'm sure some of my doctors that take care of me know, but you know, some of them don't.
Yeah.
And if they don't know, I don't make it a point to tell them. And then you can clearly see how some doctors are able to really bond with their patient, go, okay, this is what he needs, this is what he doesn't need. And some people are just like, hey, this is the way I do it. So any words? Because I think you are, may I share some things about you? On the spectrum of nervousness, you're probably on this end of the highest end of the spectrum of nervousness.
True.
Okay, so I'm sure prior to surgery, you were kind of like, oh my God, what's gonna be, what's gonna happen? I mean, there was a lot going on. And having crossed, I think, the first major mountain range, you know, all that kind of stuff, and you're now on smooth street for the most part, what do you gotta say to 7.8 billion people?
Well, just watch out because I'm gonna look so amazing.
There you go. Okay, that's what, on those words I get, that's a great point to stop right there. So world, and by the way, I think I now have to change my number. I thought it was 7.8, it's now 8.2 billion. I'm sorry guys, I used the wrong number. 8.2 billion people on Earth. Watch out, Kim's coming.
I'm coming.
There you go.
That's awesome.